Hey guys, welcome back for another episode of 5-Minute EMS Review. Today we are continuing our series on EMS medications by discussing aspirin. Let's dive in. Aspirin, which you may see abbreviated ASA for acetyl salicylic acid, is an NSAID or non-steroidal anti-inflammatory drug, as well as an antipyretic or anti-fever drug. It also has anti-platelet aggregation properties, meaning that it prevents the clumping of platelets. We will get into that more in just a minute. Due to its anti-inflammatory and antipyretic properties, you may see it show up in your pain control and fever protocols. However, one of the primary reasons we give it is for cardiac-related chest pain. Because of its antiplatelet aggregation properties, aspirin is beneficial in the setting of acute MI and cardiac-related chest pain. Often I hear providers say that they are going to give a chest pain patient aspirin to relieve their pain. However, the reality is that in the setting of acute chest pain due to ischemia, we are attempting to prevent the progression of any blockages in the coronary arteries, not resolve pain. We are attempting to keep platelets from clumping and forming more of a clot on top of the embolus or thrombus that has formed in one of the coronary arteries. This means that we are trying to keep the coronary arteries open so that blood and oxygen can continue to flow to the tissue. This may help prevent any further pain development by keeping that blood and oxygen flowing, but it will not dissolve the clot, and it is not intended to relieve any existing pain from ischemia. Now that we see the purpose of aspirin in cardiac-related chest pain, let's look at a few cautions. Since aspirin prevents the clumping of platelets needed to begin the clotting cascade, it should not be given in the setting of active GI bleeding, such as GI ulcers, or in other active bleeding disorders. It is possible for aspirin to cause angioedema. In addition, bronchospasm is a possible adverse effect, so caution should be taken in the setting of asthma. Dosing will depend on the indication for use. Cardiac chest pain protocol calls for a dose of 325 milligrams PO. You will see other doses possible for pain control and fever uses. That does it for aspirin. So that's all for today. Thanks for tuning in. Be sure to join us next time as we look at adenosine. We would really appreciate it if you pass this channel along to anyone you think may benefit from it. We're hoping to target new EMS students as well as current providers looking for an opportunity to sharpen their skills. Thanks again. We'll see you next time.